Good evening. My name is Professor Caleb Blaha, and our top story tonight is a dangerous disease known as TB. There have been a recent outbreak in cases of tuberculosis across the U.S. My colleagues and I are here to educate you on this terrible disease. Tuberculosis, also known as TB, was first discovered by Dr. Robert Koch in 1882. But TB existed long before that. Over the years, TB has been treated in a variety of manners. In the Middle Ages, one treatment method was royal touch, which was the belief that physical contact with royalty would cure the ailment. Another popular method in the past was blooding, or the draining of blood from the body. Then came sanatoriums and surgery, which persisted until the discovery of antibiotics. TB also encouraged pasteurization of milk and the quest for antibiotics. Now we go to Dr. Brandon Hill, who will tell you about the TB bacteria and how it spreads.
Thank you, Professor. Hello, my name is Dr. Brandon Hill, and tuberculosis is an airborne disease that is transmitted from person to person through the air. Animals are not affected by this disease, so you can only get it from humans. This disease is very unique. After studying the bacteria, we noticed that it is very similar to a normal bacteria cell, but the outside of it has a protective waxy layer that makes it almost impossible for the immune system to fight off tuberculosis without the assistance of antibiotics. Unlike other bacteria, this bacteria reproduces very fast and only needs oxygen to reproduce. Further autopsies revealed that the buildup of the bacteria causes white bulbs to start to turn the lungs and other organs hard. It is mainly found in the upper part of the lungs. Now we go to Dr. Josh Bruckner, who will tell you about treatment options and how to prevent TB from spreading.
Thank you, Doctor. Hello, my name is Dr. Josh Bruckner, and treatment consists of 5 drugs: isoniazid, rifampin, rifampicin, ethambutyrol, and pyrazinamide. These drugs counteract the effects of tuberculosis by killing off the bacteria. Treatment will normally last 6 to 8 months, but may last longer if you do not follow your doctor's instructions, as TB has a habit of building up a resistance to these drugs. There are 2 types of tuberculosis: latent TB and active TB. When you have latent TB, that means that the bacteria is in your body but is only dormant. If you have active TB, that means that the bacteria is in your body and is reproducing. The way to prevent yourself from getting tuberculosis is to avoid contact with anybody or being in places where tuberculosis is present. There is also a vaccine called PCG that will decrease your chances of getting tuberculosis.
We hope you learn more about this disease and will take measures to stop this outbreak. On behalf of my colleagues, I say thank you and good night.